Welcome everyone to our weekly COVID-19 Q&A with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining me again today.
Yes, absolutely. Thanks for having me.
My pleasure. My name is Dilshad Burman. I'm a writer and reporter with City News and City News 680, and I will be moderating this chat today. If you are joining us for the first time, this is actually our last chat. We have now done, this is our 90th Q&A session with Dr. Dubey. It has been a fantastic run. We've been doing these since the end of April 2020. And so it's been a long run. We've had a lot of amazing questions for the doctor, and she's been so patient answering them all for us. So this one is going to be our last regular weekly one. We might be back in another iteration. Stay tuned for that. For today, we are going to start with questions that we have been gathering for the last few days, and we're going to present them to the doctor. She's never seen them before. She's going to answer them all off the cuff. And if you haven't had a chance to submit your questions, you can still do so in the live chat, and we'll try to get to as many questions as we can in this short 30-minute period that we have with the doctor. So doctor, are you ready to start? We're going to start today with vaccine questions.
Okay, let's do this.
Let's go. Last session, let's go. Vaccine questions. Let's start with Mason. Mason asks, can you explain why Canada approved under 16 vaccines, but the World Health Organization doesn't recommend them? Where are we getting our long-term safety studies from to provide adults and kids to make an informed decision?
Okay, so it's up to each country to license a vaccine product to provide for their population. And so Health Canada is the one that has reviewed the data from Pfizer for 12 to 17-year-olds, and then for 5 to 11-year-olds for the pediatric vaccine to approve it. The World Health Organization makes recommendations for the use of vaccines around the world. There are still billions of adults around the world who are not vaccinated, and so I think part of their recommendation is really to try and get as many people who have not had their first dose, those vaccines as well. So that is part of the World Health Organization recommendations, which can differ from country to country.
Right.
But in terms of the data on safety for the pediatric vaccines, they were submitted to Health Canada by the manufacturer. And then we have ongoing safety data that we're collecting now that we're providing the vaccines as well.
Right. And so essentially, while the World Health Organization makes recommendations, you said it's up to each country to decide based on their own research and what the vaccine companies submit, right, to Health Canada.
And which vaccine they license. So you will also notice that the World Health Organization has a number of WHO approved vaccines, not all of which have been licensed in Canada.
Right. Okay, and then let's move on to our next question. Another one from Twitter. NACI fully admitted that there were not enough kids to do a proper trial on children. So this vaccine hasn't been fully approved yet, and it's only under emergency use. So why should we be vaccinating children if that's the case?
So actually, the pediatric vaccine is licensed under full authorization. It's not under an interim order or emergency use in Canada. NACI actually just updated their recommendation this week, where they strongly recommended the vaccine for children. We actually have experience from millions of children who have received this vaccine. Well over 8 million children in the U.S. have received this vaccine. The U.S. CDC have posted information on how this vaccine in children is safe, continues to be safe, and actually does work. And so, as we have more and more data, the recommendations will continue to be updated. And in this case, it's all in the right direction.
Right. Okay. And then let's go to Tess's question. For non-vaccinated kids returning to Canada and who have just recovered from COVID abroad, do they still need to be quarantined for 14 days? And what is the point of that quarantine?
So you'll have to confirm quarantine requirements from the federal government. But as far as I understand, there is no ability to recognize a recent previous infection to get cleared from quarantine.
Right.
Vaccination can certainly ease up your quarantine requirements or your testing requirements, but previous infection, as far as I understand, is not included.
Right. And then let's go to Rebecca's question. why are unvaxxed or partially vaxxed students and staff not all being given the same direction regarding isolation periods? For over 12s, it's 10 days, and for under 12s, it's 5 days.
So these are from the provincial government. These are the guidelines from them. So 12 and older unvaccinated, yes, they have to isolate for 10 days. 11 and under, whether if they are vaccinated or even not vaccinated, it is 5 days. And so that's the guidance that we are following.
Right. And doctor, is there any sort of, I think most people are asking for what's the logic of it. Is there any, in terms of, how long the virus incubates or how long it takes to get over symptoms? Is there any sort of logic in that sense?
We do know that younger children tend to have less symptoms with COVID in general. And so there is that point. We also know that the older children have had ample opportunity to receive the vaccine, and that the 16 and 17-year-olds can often behave more like adults as well.
Right. Okay. Let's move on. Will schools have the authority to mandate COVID vaccines for middle or high school children and open fully only to vaccinated students?
So I can't comment on behalf of schools. I mean, I don't quite know what they can do. I'm sure a private school can have their own entry requirements, actually, to admit students. What we have right now in Ontario for immunization for students is the Immunization School Pupils Act. And even in that act, it requires that students be vaccinated or have a valid exemption. All students can attend school, but if you are unvaccinated, you may have to be excluded from school in certain circumstances.
Right. Okay, Matthew asks, and I know that this is changing very soon, but currently, why have we shut down establishments that already require proof of vaccination?
So we, in this Omicron wave, hit a real difficult point with our healthcare capacity. And so that's why additional restrictions had to be put in place. And we know that actually they have worked. We know that actually by looking at cell phone data, for example, more people are spending time at home, similar to what they did last year around this time.
Right.
And we know that if we can reduce our contacts with each other, we can actually prevent the spread of COVID, including Omicron. And so that's why, that's one example for why more measures were put in place. But as of next week, some of those restrictions will be being lifted, as I understand, by the province.
Yes, absolutely. And so speaking of lifting restrictions, then this is a question from Jay Pack. In regards to gyms reopening, the rules within the gym state that you do not have to wear a mask while working out. And it's only necessary when you're walking around inside the building. So my question is, if this new variant is so contagious and airborne, why is it okay to be in a room full of people who are breathing heavily and the potential of catching COVID is greater? Even with less capacity, it's still putting people at risk. So what is sort of the solution there? How do you take more precautions, and why are they opening gyms?
Okay, so I haven't yet seen the regulations for what will be in place for Monday. So I can't really comment, like maybe masks will be required. I don't know. I haven't seen what the regulations say. Right. What I can certainly say is you're right. I mean, in those indoor settings, especially if the ventilation is poor, especially if there's crowding or, and people are breathing heavily, like when they're exercising, that can be definitely a higher risk situation for the spread of COVID. So I think what we're going to have to see is what restrictions are in place. You yourself too are going to have to make some assessments. So if you are higher risk for getting very sick from COVID, maybe you have a chronic health condition, maybe you're pregnant, maybe you're older, you might want to make certain modifications in the choices that you make, even if things do open up.
Right, absolutely. I think we've talked about this from the beginning through all 90 episodes that, it's about self-risk assessment. Decide for yourself how risky it is or how okay you are with exposing yourself to that, right?
Yeah, and I think a good question to ask the gym is, what is the ventilation like there? Can they open windows? And also recognizing that outdoors is still the safer bet. And if that is an option, that certainly is one to consider.
Right. And doctor, speaking of outdoors, just because we've been talking about masking for so long, and now we've been saying that, N95s are probably still more protection and better. If you are outdoors and you don't plan on stepping into any stores, you're just taking your daily walk, is it still recommended to wear a mask like an N95 while you're just on a walk if it's not too strenuous?
Yeah, so as long as you're able to keep a physical distance when you are outdoors, then no, you don't need to wear a mask. The real recommendation is to wear a mask indoors and outdoors when you can't keep a physical distance.
Okay. Let's move on to AB's question. AB asks, if you've recovered from COVID, do you still need to social distance? Can you still carry it and infect a person that has never had COVID?
So if you've completed your isolation, you're very less likely to still be contagious. So for example, if you're vaccinated, it's the 5 days, as long as your symptoms are improving. That's the other piece. If you still have symptoms and they're quite strong, you really still need to be in isolation. Symptoms can sometimes be a marker for contagiousness as well. Not the only one though. I would definitely still say though that at least in the 10 days from when your symptoms started, that you should take all precautions not to be around those who are in high risk settings, not to go in a long-term care home, to be around elderly, to take those additional precautions as well.
Right, and social distancing, whether or not you were recovered from COVID, had COVID, never had COVID, that's just a general recommendation, right? Stay 6 feet away.
And that still works, yes. And I think we also have to be very mindful. This is Omicron that is now here. We actually still have a little bit of Delta circulating. Some of the people in hospital are very sick because they have the Delta variant. Right. And then we don't know if there's another variant that may be coming. That, we saw Omicron come so quickly into our community. And so that's the other reason that we actually still need to be mindful that the virus, a new variant may be out there. And so we need to continue to just take precautions, not to think, oh, I got Omicron now and I'm vaccinated. Now I don't need to do any precautions because, that other variants are still being detected, even in Canada, though not a lot, and around the world.
Yeah, we just did a story about a new subvariant, I believe that's already here, a subvariant of Omicron, I think. I don't know how much we know about that yet, but apparently it's already here. So it's still ongoing for sure. Let's see if we can take a live question here. Question from Geosonic. Hello, doctor. More evidence is mounting that Omicron is far more dangerous for people with selective IgA deficiency, leading to a higher chance of cytokine storm and acute respiratory distress syndrome. Can you comment on this and why people with IgA deficiency do not qualify for a fourth booster? If the risk is higher for people without IgA, why is the government overlooking this population?
Okay, so these are really good questions. I think what I would certainly suggest is that you talk to your doctor about, whether you are, like the people who are getting, it's a 3-dose primary series. So 3 doses for your, to be considered fully vaccinated, so to speak. And then the 4th dose is considered that booster dose. Those are people who are moderately to severely immunocompromised. Right. Now, there are certainly people who have health conditions that may put them at higher risk for getting very sick from COVID, and not all of them are being recommended for the 4th dose, for another booster dose, for example. Right. So I think we'll have to wait and see. Usually the science does catch up with the recommendations, but if you have a health condition that puts you at higher risk for getting very sick from COVID, I would certainly encourage you to take those extra precautions for yourself beyond just vaccination. Like, definitely get vaccinated, but again, that masking, avoiding indoors, making sure you people who you meet with have no symptoms, for example.
Right. Okay. And let's just jump back into our submitted questions. Okay, this is from Christmas time, but let's take it. Our family was infected with suspected Omicron at Christmas. Is there any data to indicate that the amount of times indicate the amount of times these antibodies from this previous infection remain effective for preventing another round of Omicron?
Yes, I have that question, and every day I kind of look for the answer. Not really clear because, as you know, the vast majority of people who have gotten Omicron have gotten it in, weeks, maybe a month, maybe 2 months. And so we really have to, we do know that when you've had a COVID infection, you do have some immunity from that. Absolutely. The question is, how long does the immunity last? Will it last 3 months? Will it last 6 months? And we just haven't had Omicron around for long enough to be able to answer that question.
Right. But in general, from the beginning, the original COVID strain, we were saying it was 90 days, correct? After an infection.
That's right. We just don't have the specific information for Omicron, whether it will be 90 days, for example.
Okay. Okay, let's go to the next one. Nikki asks, do you think it's a good idea for universities to begin in-person learning? I know this has been a hot topic recently as well.
Yeah, I think, when we think about what is reopening, next week, for example, just because it's reopening doesn't mean that Omicron is gone, doesn't mean that we can just all of a sudden forget about everything that we've been doing. And so we will still need to take precautions, like wearing a mask when we're at university, screening to make sure that we're not attending if we have symptoms. If we have symptoms, do you have access to a rapid antigen test, for example, to confirm and stay home and isolate? So we are still going to have to take precautions. We saw children go back to school. They're attending school. There is certainly, value in education. And so we have to be able to balance all the benefits and the risks.
Okay. And let's take this question from Mama Moose. How is long COVID data being tracked and studied in Ontario?
So, there are some clinics that are long COVID clinics, so there may be some data coming out of that. It's not a particular surveillance marker, like where, if you have long COVID, you report it and we can keep track of the numbers. It's really mostly based on some research studies to kind of get a sense for how much long COVID is out there. And also relying on some of our research colleagues from around the world to help us to understand more about long COVID.
Right, okay. Let's take this question from Kevin on YouTube. Okay, I know this might not necessarily be within your ken, doctor, but let's try. How can you restore the public's trust in the medical community's expertise after it was politicized in support of restrictive lockdowns here and in other countries? It's a big one.
Well, I think these are the decisions that have had to been made through COVID have been very challenging. And, it's always about balancing the benefits and risks. The most recent, this fifth wave, we had a very, very significant crisis in our healthcare system, which is still ongoing. I can tell you, as an emergency medicine physician working as an emergency medicine doctor for 20 years, I have never seen it this bad. And we have flu every year. We have peaks of flu every year. But this, even through COVID, this has been by far the worst that I have ever seen it. And so, as we find with each wave, there seems to be different parts of COVID that present themselves and that require different interventions. And so I think that's what I would say to you in terms of the trust of, decision makers and healthcare who have had to make very tough choices given the current situation that we're at. And there's no playbook. We don't know what's coming in the next month or two, but we all will have to adapt because this virus is continuing on despite what we may think or want for the future.
Right, absolutely. And like you said, there's no playbook. This is not something we've dealt with before. So unfortunately, it's a lot of it is also trial and error. We don't know what works till it sticks.
Yeah, we have some data and some evidence of things that work. It's just that you want to be able to balance, the benefits and the risks. We know that staying at home works, but we recognize that has a lot of side effects as well.
Yeah, absolutely. Okay, let's go to JD's question from our submitted list here. When will the government and medical professionals explain to people the side effects of the vaccine, like myocarditis? I've been diagnosed with this since November, lost my job because of it, and it's a very serious side effect.
Okay, so myocarditis is inflammation in the muscle of the heart. And there are actually a lot of things that can cause myocarditis. I think many people didn't even realize this as a diagnosis before COVID, but there are a lot of viral infections that cause this, Salmonella, Campylobacter, and other viruses commonly cause myocarditis and pericarditis in otherwise young, healthy individuals, mostly males as well. We know that COVID can cause myocarditis as well. We also know that the messenger RNA vaccines can be linked to it. Now, it's rare following the vaccination. We know that if it occurs following vaccination, the recovery is faster, often without medications, and back to full activities. The symptoms are gone. So I think the question for you on myocarditis is absolutely, we want people to be aware of the risks of myocarditis that can occur from more than just vaccines, right, and to be aware of the symptoms, to get medical attention if you have them.
Okay. And I think, Doctor, from the beginning, maybe not from the beginning, but once it was discovered, it has been listed as one of the possible side effects, correct, of the mRNA vaccines?
Absolutely, yes. You know, informed consent is about understanding the benefits and risks of vaccines, for sure.
Okay. And then let's move on to this live question coming in from Marina on YouTube. Do you feel like mental health care will improve and increase in response to this pandemic?
It's certainly my hope, and it's the hope of a lot of healthcare professionals who have really seen, you know, the impacts of the pandemic on mental health. I mean, we've had impacts of mental health even before the pandemic, and they've certainly been magnified because of the pandemic. And so ensuring that people have access to these resources, it's been talked a lot on some of the tables that I met regarding children. And, you know, that's one of the reasons for having schools open, because that's often a way that children can access some of these services as well.
Right. And Doctor, we've talked about this before, but very good to reiterate. The city and public health have certain resources for mental health. Could you tell us where we can find those?
Yes, good point. So mental health promotion and mental health resources are certainly available on our website. 211 is a really good number to call. And so you can call 211 and they can actually link you to the resources that may be available in your community. Because this has been a challenging pandemic. Like we do say, it's okay not to be okay. And please do, there are resources available even now.
Right, absolutely. Okay, let's jump back in to a school question here. Rob asks, why is it that in the new Toronto Public Health guidelines for school screening, if a student has a symptom, the house members don't have to isolate, but if a house member has a symptom, the whole house has to isolate?
So it does go both ways. Now, the one piece that I think is worth clarifying is that there are A-level symptoms and B-level symptoms. So in the A-level symptoms, it's cough, fever, trouble breathing, or loss of taste or smell. If you have even one of those symptoms, the student stays home and the whole house stays home. The B-level symptoms, though, are symptoms like runny nose, headache, not feeling well, tired, nausea, vomiting, or diarrhea. You need, if a student has one of those symptoms, they stay home for 24 hours. If the symptoms improving, they can go back to school and no one else needs to isolate. But if they have two or more of those symptoms, then they need to stay home, as does the whole household.
Okay, so it's differentiated by the symptoms as well, not just who's got it and who doesn't.
That's right, that's right.
What kind of symptoms? Okay, good to know. That's a good distinction for sure. And then let's go to a Twitter question. 42 The Truth asks, I keep seeing articles mentioning Omicron symptoms are different, yet none of them say what the different symptoms are. Can you please explain what the different symptoms are of Omicron?
Yes, absolutely. So we say that Omicron affects the upper airways. And so what does that mean? It means the nose, the throat, actually where the face is, the airways there. That Omicron tends to affect that. So that's why we've added runny nose, nasal congestion, sore throat, for example. those are some symptoms that are more common in Omicron compared to some of the other variants that we've had.
So it's not necessarily in your lungs then, it's more up here?
It can still get to the lungs, which is how some people end up with more severely sick, but it also includes the upper airway symptoms. We also know that the loss of taste or smell is less common with Omicron compared to some of the other variants as well.
Okay, that's good to know, because in the past we mentioned that is the sure sign of COVID, is that if you lose your taste and smell, it's not just a cold or it's not just some other virus. But with Omicron, that's not the case.
Oh, no, it is still the case. It's just that not a lot of people are getting that.
Okay.
So if you have that, it probably still means that you have Omicron. Now, I've heard some people say, but I have sinuses and I'm all congested and that's why I can't taste or smell. And that may be the case, but you actually have to make sure it's also not COVID.
Right. Okay. Okay. And then these are, I think, two questions from similar questions from two different people. Let's ask this one. Will Canada be importing the Pfizer pill? And is it approved here? And will it be effective against all the variants?
So the most recent pill that was approved was the Paxlovid. Did I pronounce that correctly? Yeah.
Yes,
and so
Paxlovid.
we are waiting for more supplies, for figuring out how to be able to access it. It is a pill that is recommended for people who are 18 and older who are at risk of getting very sick or from COVID. So it's not the kind of thing that anyone who has a runny nose can get the pill and be treated with it. Right. So, but I understand that right now supply is a concern, but it has been approved. So that's one step in the right direction.
So it's on the way. So doctor, when it comes to taking the pill though, the pill is for after you've been infected, right? It's not a preventative. It's not something that's going to stop you from getting COVID.
Yes, very good point. So you have to actually take the pill within 5 days of when your symptoms have started. It will not prevent an infection. It is not a replacement to vaccines. And suppose someone in your home has COVID. If you take the pill, it will not prevent you from getting COVID either. So it cannot be used as post-exposure prophylaxis either.
Right. Okay. Okay. And then we have a few minutes left here. Let's take MJ Moore's question. Does a previously positive person have to isolate for 5 days if a member of their household catches COVID? So I had COVID, I'm fine now. Somebody else in my household caught it. Do I have to isolate?
So if you're all getting it back to back during the same time, once you've cleared your isolation, your 5 or 10 days when you have symptoms, then you don't have to re-isolate in that same time frame. As I understand, there will be more guidance coming out on this as well. Right,
right. Because especially when it comes to a household, could you actually, this is a question, could you potentially just pass it back and forth and get infected and then reinfected, infected and reinfected? Is that possible hypothetically?
Yeah, we haven't. This is the thing, is that once you've gotten it and you're confirmed that you've had it, you've had a rapid antigen test and it's positive, you're not likely to get reinfected within, a couple of weeks or even within a couple of days. Okay. So what we don't know is how long you will be safe from reinfection. And so that's why once you have symptoms and you're cleared, you're free. And the others in your household, if they develop symptoms, then anyone else who hasn't gotten it has to continue to isolate though.
Right. So if you have gotten it, then you can release yourself from isolation?
Yes, if you've gotten it and you've completed your 5 or 10 days, you can release yourself, yes.
Okay, good to know. Sorry, release yourself was the wrong word, but it was like you're free from isolation. Okay, let's
try. Self-isolation ends, yeah.
Right. Okay, let's squeeze in a couple more questions. Carol asks, what is the long-term plan for immunocompromised individuals who have been housebound to protect themselves and not catch COVID for the safety of themselves as well as the general public? Because apparently it is possible that it can mutate in immunocompromised people. So what is the plan for them? How long do they continue to take these very stringent precautions?
Okay, well, I certainly think that if you're severely immunocompromised, right, like getting vaccinated is going to be really important. Having the people around you vaccinated as well, and then, wearing those good masks, and then, avoiding those higher risk exposures will be really important. I think when we talk about, immunocompromised people who may have gotten COVID and the COVID has mutated, it's not necessarily in vaccinated people who have gotten COVID. I think the understanding is that it might be, say, in parts of the world where the vaccines are not routinely available for adults, for example.
Right. Okay. So essentially the long-term plan is get vaccinated, everybody around you get vaccinated, and I guess reach herd immunity at some point.
Continue to follow the precautions. We will get out of this pandemic. We will, right? And if you're very severely immunocompromised, I mean, you have to watch out for all viruses, really, right? And so some of those practices, washing your hands, keeping a distance, they will be important when you are in that very vulnerable state.
Right, absolutely. Wow, that half hour went by even faster than usual. It is already 1 o'clock. So we'll wrap this up now. Thank you, doctor, so much for these past many months, 90 episodes worth of AMAs. That's about 45 hours that we've been talking to each other and answering people's questions. So once again, just a very big thank you, doctor.
Yeah, thank you. And thanks to everyone. These have been fantastic questions. Really enjoyed this. And, stay safe, get vaccinated. We don't know what the future holds, but, with science and the right answers, we will get through this.
Yes, absolutely. That's a hopeful note to end on. Thanks, everybody, for the past several months of submitting all your questions and these lovely interactive sessions that we've had. I'm sure we will see each other soon. For now, we're going to say thank you and bye-bye. Bye, doctor.
Bye.